Hello, everybody. Welcome. My name is Burak Özkösem. I'm the founder and the CEO of Pera Labs. Today, I wanted to talk about our flagship technology called Sperman. Okay, the graphics might be kind of looking different, but anyway, so the content should be the same. So Sperman is world's first AI-powered sperm sorter. What I mean with the sorting means physically it does the separation comparing to the others I'm going to be talking about. So why we came up with this idea and why we need this technology, why the world needs. The major problem we have with right now the world's population with the sperm counts and then also the number of fertility treatments. The fertility treatments, when we look at it, if you see here, all the way from the laser, okay, no laser. The red line you see, that's the success rates of fertility treatments over 20 years, more than 20 years. And then, but the number of couple are going through the IVF exponentially increase. And especially with the COVID, imagine that 1 year, none of the fertility clinics were open. So there's a huge waiting list for couples to start having a family. So that's why we need the certain technologies. So half of the technology, the problem, the fertility problem, it's related to the men. So there are a lot of opportunities and new technologies for women's side, but when we look at the sperm, it's a deserted or untouched area. So, and then it's expensive, of course. 2 days ago, I don't know if you heard the news, there was a new publication came out. It shows the numbers. So this is the average, world average sperm concentration, 1973, and right now it's 50% lower. So my grandfather actually had way better and more sperm than I had. And imagine that what's going to happen in 20 years or 50 years. And we thought that it was all with the developed world, but it's not. All around the world, including South America, Africa, and Asia, and not only Europe and US, they have this problem. So everything is half down. And then we don't know why, but what we think that it's one of the major things. Right now, the semen analysis is having the pain, the points. When we look at it, it is still old school. Like it's very time consuming, and there are a lot of accuracy issues. And then it costs a lot of money to do the whole process because you have to hire a senior embryologist. And then there's no sperm DNA test done at the moment. And what we know with the damaged DNA in sperm, it doubles the risk of miscarriage. And then when we look at the fertilization rates, it's lowered. So that's why we developed Sperman. And it not only detects the good sperm with the good DNA quality, but also separates them, selects them for use further. This is a prototype. Everything is digitally connected to the cloud, so you get the really nice results. And also for end user, for the patient, so they can understand the report. But for the clinical grade report, we also have for the doctors. It uses a microfluidic chip. It's like a printer and a cartridge, you think. The cartridge does the separation, and then the algorithms basically punch the numbers, get the highly accurate classification and results. So, yes. And how it works, the chip goes inside the machine. There's an imager. All the video clips are sent to the cloud. It's a video annotation. All the AI so far, people talked here, related to the images mostly in health. Ours is with the video, so it's very difficult because it's the only cell moving and very tiny comparing to the radiology images. Anyways, everything goes to the platform, the portal, so you get your information for the clinics as well as for the patients. So why we are doing this and who we are. All the way back to the research, our technology is science-backed. During my PhD and later I worked on sperm DNA damage and oxidative stress specifically, and then we have some preclinical data and some preliminary results. On the left, if you see the one using the chip prototype we have, the selected sperm cells were actually able to attach to the egg. And then if you look at the bottom, you'll see that only few cells were able to attach. This is the first part of the fertilization because they need to be able to bind to zona, and then they can, one of them can hopefully go inside the egg. And then on the right-hand side, if you see that, this is a mouse model, of course, not humans. You see that there's a really drastic change and significant difference with our technology versus the manual method. Manual method is just sitting in front of the microscope and doing the analysis. When we look at it further, what we saw that using our chip and the Sperman chip, the system, what we selected actually, they had a better DNA quality and in a way better way, more normal morphology, as well as increased fertilization rates. Of course, yeah. So what we do is pretty much we annotate all the video, the clips of the sperm cells, depending on motility, means how they move, morphology, and also the number of sperm cells, and as well as the DNA quality of these cells. So right now there are some other examples or some systems. They can do the analysis part, but they cannot do separation automatically. Right now, the Sperman is the world's first and only automated sperm sorter. And then none of them can do the DNA test, of course, in it. Of course, when we look at this, the clinics are going to be needing this device. Our goal is to sell this device and then the consumables to the clinics. The fertility clinics are easy to work with. It's not like a hospital management, so you can go through the administration and decision-making way easier. And then our projection is that the whole semen analysis got sped up pretty much 9 times average. So when we look at it, of course, the male fertility testing market is huge. It's around 7 billion. This is like a 2020, year 2020 numbers. Now even it's further. But what we did was we connected everything to the digital concept to have the platform, online platform, so other companies and other products, basically, technologies can be connected. So this technology can also be used for animals, especially for livestock. If you're a dairy producer versus the meat, so you need the females, not the males. Basically, we can do the XY sex selection in the sperm. So when we look at it, of course, it requires a know-how. It's a patented technology, by the way, I forgot to say. It requires a big know-how and a really great team to accomplish this project. And I'm very happy that we have an amazing team. Some of our here. We have a stand downstairs booth. If you have more questions, you can come downstairs and talk to us. And yes, thank you very much. And what I say is like, let's build healthy tomorrows together. Join us. Thank you.